So I woke up one morning with a stabbing pain in my shoulder, radiating pain down my arm, numbness in my hand. I couldn't move. I could hardly get out of bed. It was to the point I couldn't lift my arm past like this level. And as a nurse, you kind of have to have your dominant arm to be able to insert IVs, hang fluids. I couldn't do stuff at home, putting dishes away. I had to have my kids help me. So it was very debilitating to just daily work and home life.
So Natasha is the prototypical patient for a cervical disc replacement. Young patient, good motion. A cervical disc replacement is just that. It's a complete replacement of a normal anatomic disc. It involves scooping out the entire disc, taking any fragments that might be pressing on nerves or the spinal cord itself, and replacing it with a metal and plastic implant.
We both agreed that the surgery was the best option because Dr. Bjerke was afraid if we let it go for too long, it would be a permanent thing and not an easy fix. It was scary. I've never been put under anesthesia before, had surgery, so that was kind of nerve-wracking. But they were very good here about talking me through the entire procedure, what would happen. The day of the surgery, they walked me through every step of the process and had my nerves pretty calm.
For most patients, a majority, well over 90% of patients, this is an outpatient surgery, as in it takes a short amount of time and it's predictable in its recovery enough that I observe patients for a few hours and then let them go home immediately afterwards. The beauty of a disc replacement is it allows them to get back to normal motion right away.
It was a relief just to wake up and not be in pain.
It's pretty cool. It's not many surgeries where you wake up and you notice you're instantly better, right? A knee replacement or a shoulder rotator cuff repair, those things take a while to appreciate the difference. These patients wake up and they feel remarkably better, and they know instantly that the rest of their lives is different. Seeing a patient smile a couple weeks after the operation is literally the best part of what I do.